Hi, my name is Amy Petersen, and I'll be completing my comprehensive health assessment. And my patient today is Mikkel. Okay, so first off, Mikkel, we've already established that she is here for established patient care status. So first off, I'm just going to go through some questions regarding your health history, ask you a few things, and then we'll complete a head-to-toe assessment. So, is there anything that you have come in today, any concerns, any problems that you want to address?
No.
No. Okay. Now, as far as your medical history goes, is there any sort of illness or disease?
Just low thyroid.
Low thyroid, so hyperthyroidism or hypothyroidism. Anything else?
No.
Asthma, okay. And do you take medications?
Synthroid.
Synthroid. Okay, can you tell me what that's for?
My thyroid.
Okay. And is there anything else you take?
No. Oh, Ambien.
Ambien. Okay, can you tell me why you take that?
Just because I can't sleep very well.
Okay, so for some insomnia?
Mm-hmm.
Okay. How about any allergies? Do you have any allergies?
No.
No medications or anything?
No.
Okay. And are you up to date on your vaccinations?
Yes.
Okay. How about family history? Do you have any family history of certain illnesses?
Diabetes and hypertension.
Okay. So diabetes type 1 or type 2? 2. 2, okay. And what about, as far as social history goes, are you married?
Yes.
And do you have any children?
One.
One? A boy, a girl?
Boy.
Okay. And as far as extra activities, do you exercise? Do you certain
Well,
hobbies?
lately it hasn't been as much, but I used to and still need to start riding my bike and walking and being a little more active, hiking.
Okay, good. All right. And what about any sort of like activities such as smoking,
No.
drinking alcohol?
Occasional.
Unoccasional, okay. Any drug use?
No.
Okay, all right. Well, if you have no questions, I'll go ahead and get started on your head to toe.
Mm-hmm.
And in the meantime, if you feel uncomfortable at all or have any pain or discomfort, just let me know.
Okay.
Okay? All right, so I am going to get your vital signs and also your weight and height. Can you tell me your height and weight?
5'7", 170.
7. Okay, good. All right. What does your blood pressure normally run?
About 120, in the 120s, over 60s.
Okay. My hands might be a little cold. Sorry about that. Okay. Okay, now maybe straighten your arm there. Now what I'm going to do is I'm going to pump this up. Till I don't feel your radial pulse. Okay, now I'm going to let it go. Okay, now I'm going to go ahead and pump it up. There we go. Perfect. 120 over 78. Okay. All right. Now I'm just going to get your pulse. Okay, 72. All right, and I'll get your temperature. Okay, 97. Perfect. And your respirations, 18. All right, now I'm going to wash my hands and we'll do the head-to-toe assessment. Okay, first I'm going to start on your scalp and your head, and I'm just going to feel around for any lesions, lumps, bumps, any hair loss, and I don't see any. Your texture is smooth. Your scalp is nice and clean, no dandruff, no dryness. Do you have any tenderness at all?
Mm-mm.
Am I going to put you to sleep?
Yep.
And you're normal cephalic. Perfect. Okay. I'm just going to look at your face, and I'm going to be assessing cranial nerve 7. Can you raise your eyebrows? Good. Can you smile? And frown? And puff your cheeks? Good. Okay. Now what I'm going to do is I'm going to come around and I'm going to feel your sinuses. So I'll start with your frontal sinuses. Do you have any pain or tenderness?
No.
Okay, and your maxillary sinuses, any pain?
No.
Good. Okay, now I'm going to assess your temporomandibular joint. Can you open your mouth and close and clench? Does that hurt at all?
No.
Good. Okay. Now what I want you to do, I'm going to assess your eyes. Okay, so I'll be assessing visual fields, extraocular movements, and I'll be assessing your cranial nerve 2, 3, 4, and 6. So first I'll have you put your shoes on, and I'm going to have you come over to our Snellen chart. And you can go ahead and stand right here, which is 20 feet away, and I'll have you cover one eye and read the lowest line that you can read clearly.
FDPLTCEO.
Perfect. And the other eye?
FDPLTCEO.
Perfect. All right, you got 20/20. Okay, you can go ahead and sit down. All right, so now what I'm going to do is I'm going to test your perla. Good. All right. Your pupils are equal and they're round and they're reactive to light. Now if you can follow my pen with your eyes, and they accommodate. Good. Okay. Now I'm going to do what we call a 6 cardinal gaze. Try not to make you dizzy. So if you look straight, look at my pen, and follow the pen with your eyes, not your head. Good. All right. Now what I'm going to do is I'm just going to look in your eyes. I'm going to look at the exterior part of your eye for any dryness, any itching, redness, any sort of, okay? I'm going to look in your conjunctiva. I'm going to make sure it's pink and moist, and it is. Looks really good. And your other eye, pink and moist. It's a good sign of hydration. Good. Now this last test on your eyes, we normally shut the lights off or dim them because I'm looking for the corneal light reflex. But for the sake of videoing, I won't turn the lights off, but I'll still look at your eye. And what I would see when the lights are off is a red reflex. Okay. All right. Now what I'm going to do is I'm going to go to your nose, and it's midline. It's good. Do you have any problems with any drainage, bleeding? Good. I'm going to look inside, make sure you don't have any sores. Your nasal septum is midline. Good. All right. Can you go ahead and plug one side and breathe in and out? Good. Now the other side. Good. Okay. Now I'm going to come to your ears, and I'm just going to look around the outside of your ears and make sure that there's no sores or dryness or irritation. Okay. Do you have any tenderness in your ears? Good. Okay. I'm just going to look in and make sure there's no excessive wax or drainage, and there's not. Okay, now I'm going to assess your cranial nerve 8, and it's a whisper test. So if you can cover one ear, go ahead and cover that ear, and I'm going to whisper and go ahead and repeat what I say.
Monday, orange football.
Good. Okay, now I'm going to come to this side, and I'm going to look at the same thing. I'm going to look at the outsides, any irritation, redness. Is it painful at all through here?
No.
Good. Look inside for any drainage, excessive earwax, and I don't see any. Good. Okay, now go ahead and cover that ear and we'll do the same thing.
Tuesday yellow soccer.
Good, okay. Now what I'm going to do is I'm going to look in your mouth, okay? First I'm going to test your tongue strength, which is cranial nerve 12. So if you can push against your cheek with your tongue, good. And the other side? Good, all right. Now if you go ahead and open your mouth. Okay, and I'm just going to look at your gums and your teeth. Your gums look good, they're pink and moist. Your soft and hard palate are intact. Your teeth look good, okay. Now if you can go ahead and stick your tongue out and go ah, good. Your uvula rises appropriately in its midline. Okay, and look at your tonsils. Good. Tonsils are normal in your size and they're not enlarged. All right, so now what I'm going to do is I'm going to fill your nodes, okay, your lymph nodes, starting with your epitrochlear nodes. And at any time, if there's any tenderness, just let me know. And work down to your cervical nodes. Do you have any tenderness?
No.
Good. Okay. Trachea is midline. Now can you swallow? Good. Your thyroid is not enlarged at all. It's normal. Okay. Now I'm going to just check your carotid artery. Good. Strong, but not bounding. Okay. Now I'm going to listen for bruise. Good. I do not hear any bruise. Good. Okay, now I'm just going to test your strength, your range of motion and upper body strength. If you can shrug your shoulders. Good. Okay, now go ahead and put your head down and up. Okay, from side to side. Good. All right, perfect. Now I'm going to come around your back and I'm just going to check your thoracic area. Okay, so I'm just going to take a peek here at your skin. Skin looks good. Okay, I don't notice any suspicious moles or any lumps, abrasions, anything like that. Okay, now I'm just going to feel. You tell me if you have any tenderness. Any tenderness? Okay. What I'm going to have you do now is every time I touch you with my hands, I want you to say 99.
99, 99, 99, 99.
Good. Okay. Good resonant sounds. Okay, now I'm going to get in here. And I want you to take a big deep breath and out. Good. Good equals symmetrical expansion of your lungs. Okay. Now what I'm going to do is I'm going to percuss. And I'm just listening for resonant sounds. Any tenderness when I do this?
No.
Good. Now I'm going to fill in your costovertebral angle. This is your kidney area. Any pain?
No.
Any pain in that side? Good. Okay, if you can just kind of hunch back a little bit, and I'm just going to check your spine. It's midline. Good. Okay, now I'm just going to listen. Now for the purpose of recording and privacy, I will not lift up your shirt, but sounds are better when you lift up, when you listen underneath clothing. Okay, when you can, take a deep breath in and out. Oops. And again. Good. Okay. Come around front and same thing. Okay, also for the purposes of recording, I will not take her shirt off. I will just look, inspect, and visualize and make sure there's no suspicious moles. Her skin looks good. There's no abrasions or lesions. Okay. I'm going to go ahead and just feel around. You tell me if you have any tenderness. Okay. Now I'm going to go ahead and have you say 99 again.
99, 99, 99, 99, 99.
Good. Okay. Now I'm just going to percuss. Good. Okay. Now I can see your chest rises and falls equally. You have no respiratory distress. And again, your respiratory rate is 18. Okay, I'm going to go ahead and listen. And again, I would listen under clothing. In and out. Good. Good. Okay. Now I'm just going to move to your heart, and I'm going to inspect. I don't see any pulsations in your precordium area. Okay, there's no heaves, lifting. All right, so now I'm going to listen to your heart, starting with your aortic valve, and you can just breathe normal. Okay, now I'm going to listen to your apical pulse for 1 full minute. Good. Okay, your S1 and S2 sounds are normal, and I didn't hear any S3 or S4 sounds. Now I'm just going to listen for bruits. Good. And I'm also going to listen right here at your abdominal aorta area. Good. Okay, now I'm going to go ahead and have you lay down. Okay. Now I'm just going to assess your abdominal area, okay? And again, I will not strip you down due to recording, but I'm just going to look, and I'm going to look at your skin and make sure you don't have any lumps, lesions, abrasions, scars, suspicious moles. Your color looks good. Okay. Now I'm going to listen first, starting with the right lower quadrant, excuse me. Okay, good. Vowel sounds are normal, active, and present. Now I'm going to percuss. Good tympani sounds. Good. I'm just going to do a light palpation to see if you have any tenderness or if I can feel any sort of lumps or masses. Any tenderness? Okay. Good. Now I'm going to do a deeper palpation, and I'm going to feel for any enlargement in your liver area, which is upper in your right upper quadrant, and your spleen, and I don't feel any enlargements. Good. Okay, now what I'm going to do is I'm going to assess your liver border just to make sure that we don't have any enlargement here. You can take a deep breath in and out. Good. Sounds good. Okay. Now, is it okay if I feel your femoral pulses? Okay, so I'll be testing your femoral pulse. Okay. And your inguinal nodes, any tenderness? Good, okay. Now I'm going to move down to your legs. And I'm going to look at the skin, make sure your color's good, it's nice and pink, texture smooth, even distribution of hair. Okay, I'm going to feel your popliteal pulse. Excellent. And the other side. Good, strong pulse but not bounding. And your skin looks good on this side. Texture and temperature is good. Okay, No swelling in your ankles or your feet. Now I'm going to assess your dorsalis pedis pulses. And they're strong, equal, but not bounding. And your posterior tibialis pulses. Good, okay. All right, now I'm just going to check in between your toes. They look good. Feet are a little cool. Okay, and your capillary refill. Less than 3 seconds. Good. Now I'm just going to do a little test that we call Babinski. Good. Good. Okay. Now what I'm going to do is I'm going to come up and I'm going to check your arms, your skin. It's nice and pink, warm to the touch, smooth texture. Okay, I'm going to look at your fingers, check capillary refill. Looks good. Okay. And I'll check this side over here. Your skin looks good. Pink, smooth texture, warm to the touch. And again, look at your fingers. Capillary refill. Good. Now I'm going to assess your radial pulses. And they are strong, equal, bilateral, but they're not bounding. Good. Okay. Now what I'm going to do is I'm going to assess your sensation. So if you close your eyes, and what I'm going to do is I'm going to have an object. You tell me whether it's soft or hard.
Soft. Hard.
Good.
Soft.
Good.
Hard.
Okay. And go to your hands.
Soft. Hard. Hard. Soft.
Good. Now I'm just going to do your face.
Soft. Hard.
Good. Okay. All right. So lastly, while you're laying down, I'm just going to check some strength here without showing you any private areas here. Go ahead and push against my hand. Good. Now the other way. Push against this hand. Perfect. Okay. I'll do this side. Go ahead and bend your knee and push against my hand up here. Good. Okay, and this hand. Good. All right. Now go ahead and pull your toes towards your head. Good. And then push down. Good. Perfect. Okay, if you want to go ahead and sit up at the side of your bed. Okay, now what I'm going to have you do is I'm going to hold your wrist, go ahead and squeeze. Perfect. Okay. Now I'm going to check your reflexes. So I'll check your bicep reflexes first. Good. And your tricep. Okay. And your brachioradialis. Good. All right. I'm going to check this side, your biceps. Good. And your triceps. Okay. And your brachioradialis. Okay. Now check your patellar. Oh, good. Good. And your Achilles. Okay. Other side. Good. All right. Now the last thing I'm going to do is have you close your eyes while you're sitting down. And I'm going to give you an object, and you tell me what this object is.
Keys.
Okay. That's a stereognosis. Okay, so now I'm going to have you go ahead and stand up. Go ahead, well, put your shoes on. Okay, so now what I want you to do is I want you to put your arms out, okay, and I'm going to have you touch your nose with your fingertip and then touch my finger. Good. And the other side? Perfect. Okay, now keep your arms out. Take your heel, your right heel, and put it against your shin. Good. And the other side? Good. Okay. Now go ahead and put your arms down and just close your eyes. Okay, good. That's just checking your position sense. Okay, now what I want you to do is I'm going to have you walk to one end of the room. Just walk normal. Good. Now on your way back, I want you to do heel to toe. You can put your arms out. Good. Okay, now if you can walk on your heels to the other side of the room. Okay. And then lastly, walk on your tippy toes on the way back. Perfect. Okay, now this is called the Romberg test. I want you to put your arms out, close your eyes, and touch your nose with your index finger. Okay, and back, and then close your eyes, yep, and then the other side. Perfect. Okay, now what I want you to do, you can put your arms down, as this is called a shallow knee test. So just slightly pick up your knee and bend down. Good. And then the other side, down. Good. Okay, that concludes our test. Do you have any questions?
No.
You did really well. There was no abnormalities and didn't find anything to question. So if you don't have any questions right now, but if you do later and have any concerns, follow up with your primary care provider.
Okay,
Thanks, Mikkel.
Mm-hmm.